Welcome everyone to My Pathway to Health. This is the landing page that you will come to in order to access your members portal. Now as you're a new member, the first thing you're going to want to do is start the registration process. You're going to enter in some eligibility information. Because this is a secure site, you will create your own unique username and password. You do need to confirm your registration, and then from here on out, you simply just log in. You type in the username and password you created. Now as you enter into your portal for the first time, you're going to want to go to your Getting Started page. This is going to give you the step-by-step instructions on everything you need to do in order to participate in the program, and then what to expect throughout the program year. You're going to get some information on your health screenings, and then it's going to tell you to take your health risk assessment. To take your health risk assessment, you'll go to this left side navigation and click on to take HRA. Now our HRA is very easy to take. It's only about 30 questions and takes anywhere between 8 and 10 minutes. You simply just choose the answer that best describes you. Now once you get your biometric screening results done, they're going to be sent to us. We're going to import them in the system, and then you will receive an email letting you know that they have been posted onto your portal. By logging back into your portal, you can come into My Screening Results, and you're going to see them loaded here. By clicking onto View Data, you're going to see the results of that biometric screening. You're going to be able to see all of the tests that were done, and then your result. Now, some of these tests can be a little bit confusing. We might have heard of LDL, but we really don't know what that's measuring within our blood. But by going to View Description, it's going to take you into our HealthWise library. Here you're able to obtain more information on those particular tests, see what they are measuring within their blood, and then it gives you a little bit of national standards. That way you can kind of see where you fell before you either share your results with your doctor or your health coach reaches out to you to discuss them. Now once we have your screening results, we're going to import them into your health risk assessment, and then what's going to be generated is a personal health profile. By going ahead and viewing the report, you'll bring this report up. Now this is a very comprehensive 27-page report. It's completely unique and personalized to you. This is all of your answers off of the health risk assessment, and then all of your biometric screening results. Where you fell out of national standards and you have risks, it's going to let you know what those national standards are, and then give you recommendations on how to start making changes to lower that particular risk. Now, even if you fell into that healthy category, it's still going to give you recommendations on how to maintain that health. Now, for some of you, this really might be an eye-opener. We might have known that we've put on a little extra weight, but we really don't know where we are and what those ranges are. It's going to clearly describe those for you so you can see what yours are, what your risk category is, and then where your ranges are. Now what this also will allow you to be able to see is what long-term outcomes are going to be in your health if you don't start making changes in some of these areas that you do have risks to. Now your health coach will be reaching out to you to go over this. Please be sure to ask her any kind of questions you may have. This is a great place for you to go ahead and start making goals. And it does come up in a PDF, so you can easily print this off and share it with your doctor if you would like. Now let's go to the main dashboard page. This page is also completely personalized to you. This is all of your main health information and then all of the activity that you're engaged in on the portal. Across the top here, you're going to see your health focuses. Now this is a rolling screen, so if more than 3 focuses were identified, each time you come back to this main screen, you'll be able to see all those because they'll change slightly. If you have less than 3, what's going to be filled in are lifestyle issues like weight, exercise, and nutrition. Now any of these focuses you can click onto, and what it's going to do is provide you links back into our HealthWise library. This way you're able to obtain more information on those particular focuses. see any kind of testing or medication that might be recommended, but it's really going to give you a source of knowledge. That way you can learn about those particular focuses, see really kind of what's causing them, so that way you can kind of gauge, see where you might be able to make some changes to lower that particular risk, and in the long run, even eliminate it. Now the next thing you're going to see is your risk score. You're going to see the numeric value, and then where that puts you, whether at healthy, low, moderate, or at a chronic risk. By clicking on to find out, you're going to be able to see all of those different factors that were used in order to generate that risk score. Now you see exactly where your risks are. In some cases, you'll be able to see exactly where you need to be in order to fall into a category that is a lower risk. But it really allows you to see all the different areas that you need to start making changes to lower that particular risk score. By clicking onto the score classifications, you're going to be able to see where you are exactly at within that risk scores. So you can kind of gauge where you are with either the risks below or above you. Now, as you are with the program throughout the years, you're going to see your risk score compared to your previous ones. So each time you do take a health risk assessment and biometric screening, it's going to be added here. So that way you can easily see whether or not you are making improvements on your particular risks, kind of staying the same, or let's not hope digressing. Now the next thing you're going to see is your risk score next to your peer group. Now these are going to be the actual employees that you are working with. It's not SHS's book of service, it's not Valley Baptist books of service, it's your employer group. So that way you can really gauge where your health is compared to all the other members that you are working with. And then directly underneath there, you'll be able to see what your peer group is. Now this next section is the top 3 trackers that you are actively engaged in on the portal. We have more than 14 trackers that you are able to use, but your top 3 of activity are here for easy access. Our trackers are very easy to update. You can go ahead and click onto whatever tracker you are wanting to add entries in for. You click on to add entry. You don't even need to type the date. You simply choose it from the calendar. In this case, we're entering in our weight. We hit add entry. It's simply that easy. As you can see, it takes no time to do it. Now the great thing about our trackers is you can also update this from your smartphones. That way you're not tied just to a desktop or laptop. You can do this mobilely. So when you're done exercising at the gym, you can log your minutes or even update your food journal at a restaurant. Now the third way for our trackers to be updated are through fitness applications. By clicking onto the fitness applications, you're able to go ahead and link up with different devices. Now in my case, I actively use a Fitbit. So by clicking onto that Fitbit logo, it's going to send me directly over to that particular device's screen. Here's my Fitbit login. I hit allow. It's allowing me to sync now. From here and out, I simply just go to the calendar and choose in the dates of data I would like added into my portal. That way I really have that one place to keep all of my information located, and my health coach is also going to be able to see this so she can actively keep track of all of the different areas that I am working on. After the fitness, or after the trackers, you're going to see MAP. MAP stands for My Action Plan. It's our goal setting tool, and it really allows you to think of the different areas that you want to work on in your health. It's going to ask you 4 questions, and the reason why it does this is it's based on the intrinsic methodology of having you choose those goals. Not only does it make you more aware of why you are wanting to achieve this particular goal, but your health coach can also see this. That way you're really able to work collectively to establish a plan that's going to work for you. Now once that plan is established, you will be given a to-do list, different things to start working on to achieve that goal, and then the associated tracker. Now as you go ahead and enter in your tracker, you're going to see your progress bar go up. This is really going to keep you motivated because you know the different areas that you're working on and keeping track of is helping you ultimately to reach your goal. Now, the final thing you're going to see is the correspondence back and forth with your coaches. By clicking onto any of the messages, you're able to go ahead and directly reply back to your coach. Now, by going over to My Messages, we do have two different messages you can send into your coach. You could complete a health update. This would be some kind of pertinent health information that has come up in your daily life. Perhaps you've went to the doctor, your blood pressure was a little high, so he decided to change your hypertension medication, and you want your coach to be aware of that. The second message is a new message to compose to your coach. Perhaps you're working on a particular goal and you've kind of reached a stumbling block and you need a little support, or you have a question that needs to be answered. By choosing into the subject matter, typing into the body, and hitting send. Now, as soon as you hit send, it's going to automatically go to your assigned coach's inbox. Now, if you notice, nowhere on here do you see a drop-down box for your coach. You will be working with one coach. That way you can really establish a relationship. You don't have to worry that each time that you call in, you'll be talking to someone different. You'll have to explain your health history, what you're working on. Your coach is going to know all this because it's that same person. So then that way you can really start being comfortable in allowing you to share all of that information with your coach. Now, our messaging is also available on our smartphone app. That way, again, you don't have to come to your desktop laptop to go ahead and communicate with your coach. You're able to do this mobily. You can receive and respond directly from your smartphone. This really allows that line of communication to be that much more seamless because it's available in real time. Now, as I had said, we have more than 14 different health trackers. Your top 3 are on that dashboard page. But of course, we want you to be able to engage in any kind of activity you would like to be able to keep track of. By going on to My Health Trackers, you're going to be able to see the ones you are actively using. And then going to View All Trackers will let you be able to see all of the ones that are available to you. You'll be able to see exactly what that tracker keeps track of, and then recommendations on how to use that. Now, as soon as you go ahead and enter into a particular tracker that you're going to want to start using, it's going to then put it on this main page for you. That way you don't have to go through all of the trackers that are available. You'll be able to come here and then easily access that. We do have a food journal here for you. It's based on the USDA and it will give you the calories, fat, protein, and carbs of any of the foods you look into. You would simply just type in your food, hit search, and it's going to bring it up in the database. From here, you can go ahead and directly add this into your food journal, and then you also have the ability to star it. Now, by starring it, you're going to put it into My Favorites. My favorites are those top 20 things that we eat throughout the week. We all know we have those ones that we consume quite frequently, so instead of going and having to search through it each and every time through the database, by adding it into My Favorites, we can go ahead and easily then add that into our food journal. We have numerous different health calculators available here for you. That way you're able to again attain more health information. Perhaps you and your coach were talking about metabolic rate. You know what a metabolic rate is, but you're really not sure what your particular one is. By clicking onto that, you can go ahead and enter in your information. Now you know what your metabolic rate is. You know what your body's going to burn at rest, so you can go ahead and start making those plans as to what you can take in food-wise that you might have to burn off with more exercise. So again, this might help you with different goals you might be setting, or just gives you that more rounded knowledge of different health information. The decision dashboard allows you to go ahead and search for any kind of health topic you may have and want to gain a little bit more knowledge on. Now, this is URAC accredited, so it is good medical information. We know Google is this wonderful search engine, but it really can provide you with uncredited medical information. So by coming here to your portal, you know that the information you are getting is concrete. We also have an interactive symptom checker. This would be for those day-to-day health situations that come up in your daily lives. You can go ahead and check for a man, woman, or child. Let's say our child woke up in the middle of the night, they have abdominal pain. Now, what's going to happen is it's going to ask you a series of questions. Depending upon how you answer these questions, at the end, it's going to let you know that this is something you need to go to the emergency room for immediately, that this may be something you need to contact your doctor for, or if it's non-emergency related, different ways to treat at home. Now, we strongly stress, and so does our coaching staff, that this by no way takes place at a hospital or your doctor. But it really has shown to give you good information to make educated decisions as to whether or not this is something that you do need to go to the emergency room for. The next thing you're going to see is your activity scorecard. Now, if your employer group does give you an incentive, what you'll see on here are the different activities that you can earn credits for, and then the associated credits. You can easily click onto any of these. It's going to bring up a little bit of information on that activity, a little program information. But down here, you're going to be able to see the date and the credit count of each time that you did earn a point. That way, if your incentive is either quarterly, bi-yearly, or yearly, you're going to be able to easily gauge whether or not you're earning enough credits to earn that incentive. Your portal also provides you direct access into health grades. Again, we know it's available on Google, but by going here, you really have that one-stop area where you can get all your health information. Through here, you can go ahead and search for specialists that you may be wanting to go in and see. If you're out of the area, search for doctors that are there. But that way, it's easily accessible right through your portal. We also have direct access into HealthWise Library. Now, this is another way to obtain more health information. We have decision-making tools built right within. So this would be kind of like you went to your doctor, you're thinking of changing your hypertension medication. You can put your medication that you're on currently next to your new medication. You can see long-term outcomes, side effects, but it really, again, gives you that source of knowledge to make educated decisions of whether or not this is going to work for you, and then it brings you those questions that you can go back to your doctor so you can easily discuss. Now, down here also is where you're going to be able to find the different information on the particular programs that we may offer, which would be the smoking cessation or the First 5 program. All of that is available for you down here. Every month we do send out newsletters. It's going to tell you a little bit about the healthy monthly observances, tips around the holidays, and always provide you with different recipes. They do come out every month, and then they are kept archived here for you so you can easily go back and view any of the previous newsletters that you found articles particularly helpful with. Now, those are all the main tools and resources on your My Pathway to Health portal. As you can tell, it's a very robust system. It's very easy to go through, and we really hope that you enjoy and take advantage of everything that is offered here for you. Now, at any time, if you have any questions, please don't hesitate to call our customer support line at 800-550-2427, extension 4, because we would be happy to go through and answer any kind of questions that you may have or about using your portal. And please, make sure you utilize our coaching staff. That's what they're here for. They want you to help you achieve the particular health goals that you have set for yourself. Thank you for taking the time to listen to it, and have a great day.